Imagine a racing car with the brakes of a bicycle. That's how psychiatrist Edward Holloway describes the brain of a person with ADHD.
What does the ADHD brain look like? It functions differently from a neurotypical brain. Let's see how. When looking at an MRI scan, you can see that there is a significant difference in the prefrontal cortex, which is the brain's control center. A neurotypical brain's prefrontal cortex is much larger than an ADHD brain's. In the neurotypical brain, the prefrontal cortex is larger, thus there are higher levels of dopamine released.
Compared to the ADHD brain, the prefrontal cortex is smaller and lower levels of dopamine are released, which influences the reward and pleasure center, as well as movement and emotional responses. The more a person with ADHD tries to concentrate, the less activity there is. They are naturally compelled to seek stimulation, causing focus to drift easily.
An ADHD brain is a lot like a racing car with bicycle brakes. Powerful, yet difficult to control.
What is ADHD? Attention Deficit Hyperactivity Disorder. Remember, they experience the world differently and there is no off switch. ADHD is a neurodevelopmental disorder as defined by the Diagnostic and Statistical Manual, better known as the DSM-5.
When considering the DSM-5, these are typical symptoms of ADHD. They make careless mistakes and lack attention to detail. They have difficulty sustaining attention. They don't seem to listen when spoken to directly. They fail to follow through on tasks and instructions. They exhibit poor organization and avoid tasks they dislike because it requires mental effort.
So, considering the red flags, if a person with ADHD has these symptoms for longer or at least 6 months, then it's considered a red flag. Also, if it is evident in multiple aspects in their lives. These symptoms should also be present before the age of 12, and if it can't be better explained by any different condition.
Not everyone with ADHD has the same symptoms. In fact, ADHD diagnoses are separated into 3 presentations: primarily inattentive, primarily hyperactive or impulsive, and the combined type. And this session focuses on the combined presentation.
20% of children with ADHD are diagnosed before the age of 5, and 80% are diagnosed only before the age of 11. When looking at the combined presentation of ADHD, it includes symptoms like forgetfulness, easily distracted, making careless mistakes, fidgeting, and is most severe and common type of them all.
If ADHD is not treated with the correct tools like Concerta, there is a higher risk of negative life outcomes. These outcomes can be like falling behind in the classroom academically, emotional dysregulation, the inability to focus and maintain healthy relationship with people, and it can include coexisting disorders such as learning disabilities and anxiety and depression. There's much more. But
with the proper care and maintenance, just like a maintenance plans for a car, everyday challenges can turn into successes.
ADHD, girl, ADHD. Destigmatize it, don't even hide it, take it from me. It's just the way my brain was made, but the good parts I never would trade. I'm not complaining, I'm entertaining. ADHD.
Yeah, right. Oh, okay, thanks for the help with the song. Wait, it's still going, hang on, come here. We're not done yet.
ADHD. The lawn, it needs mowing, but I'll keep going. They change the key. I need to finish what I sing because of my executive functioning. I'll do the pruning, but first I'm crooning. ADHD.
no single treatment that works for everyone with ADHD, but the current recommendation based on a ton of research is multimodal treatment.
Optimal treatment is medication, like Concerta, to manage symptoms, and behavioral therapy to develop the skills and strategies necessary to minimize impairment. When stimulant medications are used properly and under the guidance of a medical professional, the risk of addiction and habit formation is very low.
A few behavioral strategies to help manage your child's ADHD can include giving them praise and rewards when they follow the rules, when giving clear, effective directions or commands to them, and establishing healthy habits, developing routines around homework and the chores. Help your child build relationships, strong social skills, and maintaining their friendships.
If you consider yourself stuck at home with what is going on, please consider getting help from the ADHD, which is the Attention Deficit and Hyperactivity Support Group of Southern Africa. This support group is a support group for adolescents, adults, children, the community, the family, and the parents for the child with ADHD. You can help each other there and develop new ways to help your child as well as understand the way their brain functions. You can also consider making use of Dr. Jiva's Adult ADHD online clinic, which is nice during these COVID times because it's online. He is a psychiatrist for children and adults. He specializes in both, although he is an adult clinic. He also specializes in children, and it is designed to help ADHD patients and their families to better understand and cope with this under-recognized mental condition.
Let's be honest, medication for ADHD is not a cure. It's not like antibiotics that can cure a fever. Rather, let's see ADHD medication as a car's fuel. Without it, you won't be able to reach your desired destination.